may all tend to think of the Berkshires as a carefree vacation mecca, but it's home to many people who struggle to make a living. People who are uninsured or underinsured when it comes to their health care. Connecting Point Contributor Carolee McGrath spoke with the chairman of the board and a nurse practitioner from Volunteers in Medicine about the work that organization performs in Berkshire County.
VIM was founded a little over 10 years ago with a mission of providing free health care services to people who do not have insurance and live here in this area.
Okay, so what is the population that you serve, Ilana?
We see ages 19 to 65. They're income eligible, so they're up to 300% the federal poverty guidelines. They live within Berkshire County or the surrounding New York or Connecticut towns. We offer medical services, dental services, nutrition, mental health, acupuncture, optometry, and we just added some body work for the patients as well.
I should mention your clinic is located in Great Barrington.
It is.
Okay. You know, we were talking a little bit about this before the interview, that why would this service even be necessary? If you have Mass Health, well, that means everybody should have insurance, right?
It does mean that everybody should, but unfortunately it is not the case. There was a recent study done by Blue Cross Blue Shield Foundation here in Massachusetts that found that among our target demographic, that is people from 19 to 65, under 300% of the federal poverty level, there were 20% of the people who did not have insurance at least for some part of the previous year. About 5% of that population didn't have insurance at all during the course of the year. And the reasons that they don't are several. They have situations where they can't qualify because of their residency. There are a lot of temporary residents in Massachusetts, in Western Massachusetts, because it is a seasonal economy. There are people who work on the farms, there are people who work in the arts and all of the various supporting institutions, the hotels, and they're very seasonal jobs. So they don't get employer-provided insurance. They tend to work multiple jobs, so they're part-timers. So they can't qualify. So in some cases, it's because of the residency situation. In other cases, it's because they can't afford it. Even with the subsidies that are available under Mass Health or the Affordable Care Act, there are still many people that can't afford what turn out to be very high deductibles and copays.
And then you also talked about some people who even will get that exemption from the state health plan as well.
Yes, there are financial exemptions. There are some modest other exemptions, but most of them are financially based. So if either just because of low income or if you've had an unpaid medical bill in the last 6 months, that qualifies you for an exemption. And for some people, it's just cheaper to pay the penalty.
Right, and then people in between jobs, if they had health insurance and then lost it, it takes a while to get that up and running.
It does, anywhere from 3 to 6 months, and that's once you've gotten yourself reestablished and have the income to get back in the system and pay the premiums and pay the deductibles. But about half of our medical patients are in fact just temporarily without coverage, and eventually we work with them to help to get them back on to insurance coverage. And at that point, they're no longer our patient. About half of our patients are ongoing patients for which we're their medical home. The other half, non-medical, Ilana referred to our dental services and acupuncture and all the other services, those aren't covered at all under the Affordable Care Act.
Well, what I find interesting too is that many of, or most of the people that work with you are volunteers. Yeah. That's incredible. You know, they volunteer. So these are retirees or people or doctors who are currently in practice who are there just giving of their time.
It's amazing for a provider to get back more than they put in, and VIM really allows that for these volunteers.
And you're not just saying that, you mean it. You really enjoy this.
It's really an inspiring place. People come into the door and they are really inspired. We are privately funded. We rely on grants and we rely on donations from people in the area and out of the area. And because of that, we don't have insurance to deal with. We don't have these insurance regulations. So people can take time with the patients. And there's so many people who are so unhappy in the medical field right now because they feel too rushed. They feel like there's too many regulations and they're not able to practice the way that they want. And we're able to provide people the opportunity to do that. And by doing that, they are able to provide unbelievable health care for people in this area.
And it's interesting that you brought up, the dental, for example. I mean, that just walking in can be $140 out of pocket, and that's a lot. And that would be enough for somebody to say, we'll put that on the back burner.
To be able to transform someone's smile, to then allow them to get a job, it's priceless.
So you're celebrating 10 years, and you have a new campaign.
Our second decade campaign, which is just in the final stages. This was our year-end campaign. Seems to be doing very good. I don't have final figures on it yet, but it's a very important part of our fundraising activity. All of our money, as Ilana referred to, comes from individuals. We get no government support. So it's all individuals, some foundations that help us, private foundations. And we do a great job, and our supporters are just fabulous.
Well, Ilana and Art, thank you so much for joining us, and Happy New Year.
Thank
You're
you.
very welcome. Thank you.